Coronavirus common questions everyone should know and how to keep safe during COVID-19 pandemic. Question 1. How dangerous is COVID-19? Although for most people COVID-19 causes only mild illness, it can make some people very ill. More rarely, the disease can be fatal. Older people, and those with pre-existing medical conditions, such as high blood pressure, heart problems, or diabetes, appear to be more vulnerable. Question 2. Who is most at risk to the coronavirus disease? Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. Question 3. Can COVID-19 cause miscarriages? There's no evidence coronavirus causes miscarriage or affects how your baby develops in pregnancy. Question 4. Does consuming alcohol kill COVID-19? Consuming alcohol will not destroy the virus, and its consumption is likely to increase the health risks if a person becomes infected with the virus. Alcohol, at a concentration of at least 60% by volume, works as a disinfectant on your skin, but it has no such effect within your system when ingested. Question 5. Can the coronavirus disease spread through food? It is very unlikely that you can catch coronavirus, COVID-19, from food. Cooking thoroughly will kill the virus. It is not known to be transmitted by exposure to food or food packaging. Everyone should wash their hands regularly with soap and water, for at least 20 seconds, to reduce the risk of illness. Question 6. What is the recovery time for the coronavirus disease? They found that for people with mild disease, recovery time is about 2 weeks, while people with severe or critical disease recover within 3 to 6 weeks. Question 7. Is the coronavirus disease more severe than the flu? COVID-19 causes more severe disease than seasonal influenza. While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. That means more people are susceptible to infection, and some will suffer severe disease. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Question 8. Is smoking a risk factor for COVID-19? Smoking is already known to be a risk factor for many other respiratory infections, including colds, influenza, pneumonia, and tuberculosis. The effects of smoking on the respiratory system makes it more likely that smokers contract these diseases, which could be more severe. Smoking is also associated with increased development of acute respiratory distress syndrome, a key complication for severe cases of COVID-19, among people with severe respiratory infections. Question 9. Does drinking lots of water help flush out COVID-19? There is no evidence that drinking lots of water flushes out the new coronavirus or the stomach acid kills the virus. However, for good health in general, it is recommended that people should have adequate water every day for good health and to prevent dehydration. Question 10. Can the coronavirus disease be transmitted in hot or humid climates? From the evidence so far, the COVID-19 virus can be transmitted in all areas, including areas with hot and humid weather. Regardless of climate, adopt protective measures if you live in, or travel to an area reporting COVID-19. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. By doing this, you eliminate viruses that may be on your hands and avoid infection that could occur by then touching your eyes, mouth, and nose. Question 11. How long does the coronavirus last on cardboard? The coronavirus can live on cardboard for up to 24 hours and on metal and plastics for up to 72 hours. Question 12. Can I get the coronavirus disease from swimming in a swimming pool? Swimming in a well-maintained, properly chlorinated pool is safe. However, it is advisable to stay away from crowded areas including crowded swimming pools. Keep 1 meter distance from people who sneeze or cough even in a swimming area. Question 13. Can you take ibuprofen if you have the coronavirus disease? Patients can take paracetamol or ibuprofen when self-medicating for symptoms of COVID-19, such as fever and headache, and should follow NHS advice if they have any questions or if symptoms get worse. Question 14. Does heat kill the coronavirus? Heat at 56 degrees Celsius kills the SARS coronavirus at around 10,000 units per 15 minutes. Quick reduction. Question 15. How do you get the test results for the coronavirus disease? In England, you'll get an email, text, or call from the NHS Test and Trace service if you test positive. You'll be asked where you've been recently and who you've been in close contact with. Question 16. Should I wear a mask during the coronavirus disease pandemic? In some countries, masks are worn in accordance with local customs or in accordance with advice by national authorities in the context of COVID-19. In these situations, best practices should be followed about how to wear, remove, and dispose of them, and for hand hygiene after removal. Advice to decision makers on the use of masks for healthy people in community settings as described above. The wide use of masks by healthy people in the community setting is not supported by current evidence and carries uncertainties and critical risks. Question 17. Can I breastfeed my child if I am severely ill with coronavirus disease? If you are severely ill with COVID-19 or suffer from other complications that prevent you from caring for your infant or continuing direct breastfeeding, express milk to safely provide breast milk to your infant. If you are too unwell to breastfeed or express breast milk, you should explore the possibility of relactation, restarting breastfeeding after a gap. Wet nursing, another woman breastfeeding or caring for your child, or using donor human milk. Please let us know what you think in your comments.